So heroin trade is booming in South Africa. That's according to a new study conducted by NGO ENACT. It's found widespread and problematic use of heroin in the country. The research blames poor drug policy for the thriving illicit trade. It says gangs and organized crime are driving the trade and that government has been caught unprepared. To discuss this, we're joined by Sean Shelley. He's from TB HIV Care. He joins us now via Skype, as I understand it. In fact, Sean, you're live for us from our Pretoria studios. Afternoon to you. Are we using more heroin in South Africa, or are we producing to sell?
No, we're using heroin in South Africa. We're not a producing nation. The heroin is coming down from Afghanistan and then down the coast of Africa through what's called the southern route. Most of it is actually coming into South Africa and then leaving, going for the European markets, some of it to the Canadian market. But there's also some of it that gets used here in South Africa as well. And we're seeing escalating rates of heroin use around the country.
I want to pick up on the point that's been made about how government has somewhat been caught napping on just how to prevent this illicit trade. What could have been done differently?
Well, I think that the response is the most important thing. You know, when you've got a natural route which occurs like this, there's very little that you can actually do to stop it coming across the borders. You know, to have impervious borders is almost impossible. But what we could have done is perhaps looked at some of the issues that drive heroin use, and then also look at some of the issues that can prevent some of the harms of heroin use, such as implementing better harm reduction policies, which the government is moving to do now, but it's a little bit late. And also to look at preparing the country for this and saying, you know, we really need to be spending a lot more money on developing communities and giving people valid choices in life so that they don't find the use of heroin one of the most meaningful things in their life.
I want to ask you, Sean, for those of us less familiar with heroin and what it can do, what's the appeal of this drug for those who use it?
It's tremendously appealing. It's an analgesic. So by heroin, we're talking about the Wunga, Niobe, Unga, all of those drugs, you know, have heroin in them, and heroin is the active ingredient. And it's an analgesic. It works like morphine. It, in fact, converts to morphine in the body, and it makes you feel really comfortable and at peace with yourself, and it makes life seem a lot more tolerable than when you're living in very difficult circumstances.
Who then in South Africa, you mentioned that a lot of these drugs come from Afghanistan and all the way through the coast of the African continent. Who in South Africa benefits most from the sale and distribution of heroin?
That's a really challenging question to answer, because it's certainly not the street level dealers that we see. They really aren't economically empowered to much of a degree. They live in a very precarious financial situation. When we move up the scale there, we're really looking at some of the transnational criminal networks who are really benefiting from it. There's been some implication of political parties in other African countries. We don't have any of that in South Africa yet. But in the previous report that was released by ENACT, which was called the Heroin Coast, they spoke about a lot of complicity by some of the governments in sort of the Eastern African region and Southern African region, but not South Africa at this stage.
I'm looking at some of the figures from this report by ENACT. In 2015, some 75,000 people in South Africa were said to be injecting heroin, 110,000 smoking it. But because of the way that this trade operates, I would imagine that the number of users and abusers is not as easily available as we'd like it to be.
It's not at all easily available. In fact, those figures are sort of educated guesses. We don't have accurate epidemiological data on the use of drugs in South Africa at all. And what we do know is that South Africa is not one of the worst drug countries in the world. You know, we maybe have a higher than average use compared to some African countries, but certainly in terms of the rest of the world, parts of Europe, America, and that, we're not up there. We're not sort of like the drug capital of the world, like some people would have us believe. But we do need to do something about this, and it is quite serious. And the current responses of criminalizing everybody that uses drugs aren't doing much help, because really you're taking a large proportion of the working force out of that economic space, you know, because they can't get jobs afterwards.
If not criminalize the trade, what then can be done? What do you propose?
Well, look, criminalizing has never stopped it. You know, we've had a report released recently by the International Drug Policy Consortium, and they looked at the sort of scorecard of the last 10 years of the drug war, or the attempts to reduce the supply of drugs around the world, and it's an absolute disaster. So the kinds of things we need to look at is better education of people, making sure that people understand the issues, but mostly we need to reinvest the money that we save on the criminal justice system into the economic upliftment of economically marginalised areas.
We've spoken about government's response in as far as stopping the trade itself, but what becomes for the many people, most of them in some of the poorer communities, a lot of them are very young people, what becomes of those of them who want to break the cycle of addiction? Do we have sufficient rehab resources to assist?
Okay, so the interesting thing is that we think that rehabs are going to solve the problem. They're not. There's not very good data to support that. The kinds of things we need are programs that meet people where they're at in the community, that provide them additional meaning, additional choices within the community itself, and reduce the harm so that they're not suffering the worst of the health consequences. And that way, when they are ready to resolve it and when opportunities do arise, they're not fighting diseases like hepatitis and HIV as well. So really what we need to do is meet people where they're at in the community and have a continuity of care for people that goes from the people who are just beginning to use right to the people who are at the far end. And some of those people will need rehab, but not everybody.
All right. Sean Shelley, thank you for your time.